Hello, and welcome to this episode of the Myo Minute. I am Carmen, and today I am answering the question, how soon before a frenectomy should I start myofunctional therapy? I'm going to give you my answer because obviously you're listening to this, but you're going to get a variety really across the board. So, in my practice, because I have a global practice and I have people come from other countries to see some of the powerhouses here in the United States, such as Dr. Zaghi and some of my other providers, I have to know that those people are ready. Because can you imagine how mortified I would be if somebody came from Holland to see Dr. Zaghi and he said they weren't ready? So that's where I have that requirement that I start 2 months before. So the reason that I do that is I start 2 months before because we do at least 2 sessions prior to the frenectomy. There are certain benchmarks that you have to be able to reach that are so important. The other thing is I know that my protocol is correct because I have reached out to many providers around the United States who do frenectomies for me. And my benchmark is higher than theirs, okay? My benchmark is a little bit higher than Dr. Zaghi's. And the reason that is because when you get to their office to have the frenectomy done, you're going to be nervous. They're going to get you numb. They're going to tip you backwards in the chair. And if you falter, I still want you to be able to function and do what you are supposed to do so that they can have an adequate release, okay? That's why it's so important that you see the right provider. That's not the conversation I'm having in this video. You can watch many of the other ones on that. But that's why my benchmarks are so high, because I know that you're going to get nervous. And when they get you numb, you don't function properly. So we're relying on muscle memory really for that. It's also important that you have oral tone, that you have some strength, that you be able to control the tongue and the muscles. Now, I tend to attract clients that have the worst ties I've ever seen. So in those cases, that's a little bit different because those people are going to be 2-part releases, 2 stages. But for the most part, if somebody is not, a severe tie all the way to the tip or pretty close, then they're going to be able to meet the benchmarks that everybody else is. So that was a really long answer to the question, how far in advance should I start therapy before I have a frenectomy? 2 months is the magic number in my practice when you want to work with me. I hope that helps, and I will see you in the next episode of the Myo Minute. Bye for now.